Welcome to the part 2 of this video module series. These are the non-pharmaceutical interventions or strategies that you can implement into your life to start to help you manage your type 2 diabetes. First and foremost, the most important intervention to start is exercise. Exercise is your best weapon against type 2 diabetes or any problem your body has processing glucose. Regular workouts can trigger weight loss and muscle gain, both of which help your body metabolize sugar efficiently. Exercise increases your insulin sensitivity and is therefore a key component of self-care for people with type 2 diabetes. The Burroughs Clinic recommends starting a weekly therapeutic movement program, starting with 3 times a week, perhaps working up to 5 times a week. You can consult our Movement for Life series to learn how to set up a therapeutic movement program. That will be the last exercise video module you ever have to watch. Once you learn those techniques, you will be well on your way to starting your own exercise program. The link for the program is attached to this lesson. Since most people start exercising to lose weight, you should note that even exercise without weight loss can help you manage diabetes. A 2013 study showed that increased exercise volume in study subjects improved their blood sugar test even when they had no change in their body mass index. Also, another study showed that people with diabetes cut their insulin use by $2,700 per year when they added regular activity to their lifestyle. The second thing you can start doing to help manage your type 2 diabetes is to incorporate as much NEAT or non-exercise activity thermogenesis as possible into your day. Meaning, throughout the day, move often. Get up from your chair as often as you can. Sitting in a chair for hours at a stretch causes blood sugars to spike. You're not burning any energy to speak of, so the glucose or sugar just pools in your bloodstream, wondering what to do. In the beginning, simply cutting down on your sitting time by doing housework, taking get up and stretch breaks from work, and short periodic strolls throughout the day will help you enormously. Moving around often is the key. The third thing you can do to help manage type 2 diabetes is if you are obese, you need to start to try to lose weight. If you are sedentary and have weight to lose, your first step should be to simply start walking for at least 20 minutes a day, up to 5 times a week, either all at once or in increments of 10 minutes or so. Improved fitness helps control the symptoms of diabetes, independent of weight loss. So don't worry about the number of your weight on the scale at first. Just be diligent about your exercise program and your diabetic symptoms will improve. You can consult our Health for Life series to help you start the process of losing weight, to get yourself going on a weight loss journey. The link for that program is attached to the module. And note this, losing weight is not a week-long process. It will take months. You have to commit yourself to lifelong habits in order for this to happen. The next thing you can do to help control type 2 diabetes is to stop consuming obesogenic substances. So you may ask what obesogenic foods or substances are. They are foods or products that can trigger your body to become more obese. A great resource to understand this phenomenon is laid out in Bruce Bloomberg's fantastic book entitled The Obesogen Effect. The concept here is this: the less you consume foods or food products that trigger obesity, the less fat you have on your body, which translates into the less severe your type 2 diabetes becomes. In some cases, you can even reverse the type 2 diabetes disease if you lose weight. To put this concept into effect, stop consuming foods with added and processed sugars such as high fructose corn syrup, which is found in soda. If you need to lightly sweeten something, which is okay by the way, use a little natural unprocessed cane sugar. Avoid honey and agave syrup as well. Also, strictly avoid the consumption of artificial sweeteners. These substances are highly obesogenic. They include aspartame, aspartame potassium, saccharin, and sucralose. Recent studies have shown that artificial sweeteners can damage your metabolism by altering your microbiome. Our advice from the Burroughs Clinic is to not consume them at all. Read product labels, read drink labels. If they have these substances in them, do not drink them. Other substances like food additives are highly obesogenic as well. These include monosodium glutamate, nitrates, nitrites, artificial colors, and potassium bromate. Again, our advice at the Burroughs Clinic is to not consume these foods if you're diabetic or in general. Make sure you read labels of what you're eating and drinking to make sure these substances aren't in them. So your best bet is to avoid all these substances just mentioned and to basically drastically reduce your consumption of processed or industrial foods. Stick with whole natural foods made with ingredients found in nature. The rule of thumb is if you cannot pronounce the ingredient, it does not belong in your body. Also, drink clean filtered water. Unfiltered tap water has been shown to have certain chemicals in it that are harmful to your health and perhaps obesogenic. The next thing you can do to help manage your type 2 diabetes is to lower your carbohydrate consumption to eventually to less than 150 grams a day. A high carbohydrate diet is one of the main causes of insulin resistance in type 2 diabetes. At the Burroughs Clinic, we recommend slowly cutting back on your carbohydrate intake every day until you get below the 150 gram day level. This may take a little time to do so, and initially you might feel a little less energy until your body metabolism adjusts. To do this, first and foremost, it would be best if you cut out sugary beverages first, including soda, fruit juice, and other highly sweetened drinks. If you need to add a teaspoon of natural sugar to a cup of coffee or tea, that is fine. If you need the fizz effect of a beverage found in soda, then slowly train your body to enjoy sparkling mineral water and or seltzer water. The natural flavored seltzer water is a great alternative to soda. Also, drastically cut down on your consumption of bread, pasta, and other foods made from flour, which is a processed carbohydrate. Reduce potato and fruit consumption. You do not have to cut these out, just go easy on how much you ingest. Minimize rice consumption. A good strategy for your plate is to keep the carbohydrate part of your meal the smallest. Increase your consumption of meats and vegetables to make up for the less carbs. Quit eating candy, and if you need a sweet treat, you can consider alternatives, such as a combination of natural peanut butter and dark chocolate, typically with 70% cacao or above. Actually, when you put these together, it tastes like a Reese's cup. So a caveat here is that if you're on a prescription medication to lower your blood sugar, be sure to consult with your doctor about proper dosing when starting this regimen. Theoretically, taking a medication to lower your blood sugar and consuming less carbohydrates together in tandem might lower your blood sugar too low, causing hypoglycemia or low blood sugar. So just let your physician know that so that they may be aware of this proper medication dosage to prescribe you while you are undergoing this transformation. Perhaps after a while, you can even get off your medication altogether at some point. The next thing you can do to help manage your type 2 diabetes is stick to a regular sleep schedule. Sleep hygiene is the key here. Getting a regular 7 to 8 hours of sleep at night helps to balance your stress hormones, including cortisol. Having an erratic or poor sleep schedule, as well as not getting enough sleep, has been shown to lead to increased cortisol levels in your blood. Cortisol is a stress hormone that releases glucose or sugar from your tissues into your blood, thereby increasing your blood sugar levels, which is something you do not want to happen on a regular basis if you suffer from type 2 diabetes. Ideas for improving your sleep can be found online or as part of the Burrs Clinic's The Health for Life series, which a link is attached to this program. The next thing you can do is to keep your stress levels under control. There are many ways to do this, and unfortunately, stress is a normal part of life in the Western world. Chronic stress dysregulates your hormones, including cortisol, which can wreak havoc on your blood sugar. The Burrs Clinic recommends a couple of things to manage stress. First and foremost is a practice of stress reduction technique on a regular basis. This could be a quiet, short 10-minute walk in nature or outdoors is a great place to start. Prayer and meditation is a great place too. Sitting quietly in a room for 10 minutes helps to reduce stress. The Burrs Clinic has actually created a neuro downregulation technique that helps to calm down your nerves, slowing your heart rate and decreasing your blood pressure, stabilizing your hormones as well. The instructional video to learn how to do this is attached to this program, so I highly recommend that you watch it, learn it, and implement it into your life. Typically, most people start to notice a reduction in their overall stress levels after their third session of doing this program. We recommend starting with 5 minutes and increasing to 20-minute sessions 3 to 5 times a week. It is important to take time to care for your nervous system instead of relying on powerful, addictive, dangerous pharmaceuticals to do so. So in closing, once you begin to incorporate these strategies into your life, you will notice a change in how you feel and in your blood sugar levels. However, give these strategies or interventions about 3 months to fully take effect. Do not get frustrated if you notice no difference in the beginning. These strategies are designed to change your physiology, and in the process, it takes time. Hopefully, with continued practice, you might be able to come off your diabetic medication and live a long, healthy life, free from the complications that type 2 diabetes can cause. However, a caveat here is do not stop your medications or change them unless you are directed by a physician to do so. So I hope this video helps you. I hope this program helps you implement the activities and strategies that you are given, and give yourself 3 months to notice a difference. And again, refer to the handouts and the other links provided as additional resources. Thank you for joining us, and we will see you next time.